Good morning, good afternoon, and good evening, and welcome to Facebook Live at the World Health Organization in Geneva, Switzerland. Today we're talking about World Hand Hygiene Day. My name is Janet Kincaid. I'm a communications officer here in headquarters in Geneva, and I'm joined today by my colleague, Dr. Benedetta Allegranzi, a technical lead here in the organization on infection prevention and control. Good afternoon, Dr. Allegranzi. Nice to see you.
Good afternoon, Janet.
Thanks for being here today. So
Thank
tomorrow is World Hand Hygiene Day on the 5th of May.
Yes.
Can you tell us what that is, please, and why do we celebrate Hand Hygiene Day?
Yes, for sure. So since 13 years, WHO dedicates these days to celebrate the global annual hand hygiene campaign, which is called Save Lives, Clean Your Hands.
Mm-hmm.
That gathers global attention on hand hygiene in healthcare and engages people around the world in improving hand hygiene practices in the healthcare sectors primarily.
Mm-hmm.
So in the context of COVID-19, as you know, good hand hygiene practices both in the community and in healthcare are tremendously important to reduce the spread of the virus, together with other measures that we will certainly discuss later as a comprehensive package. Hand hygiene in healthcare also prevents the spread of other pathogens, including those resistant to antimicrobials, and also prevents the spread of other emerging pathogens, so emerging health threats. So this is extremely important, as we said, and this is why we continue to celebrate this day with the focus on hand hygiene in healthcare.
Excellent. So thank you. That's a good way to start this off. If you're just joining us and you'd like to ask a question of WHO or of Dr. Allegranzi, please leave your questions using the hashtag AskWHO on Twitter, or you can leave a comment on our Facebook feed or in LinkedIn. So as we're looking at this year's slogan for hand hygiene, the slogan is seconds save lives, clean your hands. Why this particular slogan, and why the focus on point of care? And if you could you tell us what point of care is, and then tell us why we're focused on this, please?
Of course. So first of all, the focus, every year we have a theme. Mm-hmm. And the focus this year is achieving effective hand hygiene action at the point of care. So what we mean by point of care is really where care is delivered. So where any act of care is given to a patient, whether therapeutic or preventive. Mm-hmm. So normally by point of care we mean the bedside, but this can also be outpatient settings, so ambulatory care, for instance, at your GP or at a pediatrician, or even these days, the vaccination sites. When the vaccination, COVID vaccination, is administered, that moment and that point is a point of care. In this case, it's preventive care.
Okay.
So this is the focus of the campaign this year. You also mentioned the slogan, which is behind me, so seconds save lives, clean your hands. So your question was, why does hand hygiene save lives? Mm-hmm. There is really overwhelming evidence that up to 50% of cases. It is also well known that it prevents the spread of COVID mm-hmm. and other acute respiratory viruses. But also since many years we know that hand washing, mainly at the community level, reduces the impact, the morbidity of gastroenteritis, which causes diarrhea, which is, as you know, nowadays still the third cause of death among children less than 10 years. So it is a very effective action which mm-hmm. takes a few seconds, like our slogan says.
So when we say that it takes a few seconds, are we talking about 3, 4, 5 seconds? What are we talking about here?
So, in particular in healthcare, the action of performing hand hygiene needs to be quite thorough, meaning that you have to cover all surfaces of your hands and use specific movements to achieve the all hands surfaces coverage. This means that with alcohol-based hand rubs, which are particularly effective, this takes about 20 to 30 seconds to be fully effective. With hand washing with soap and water, the whole procedure, including drying, takes from 40 to 60 seconds to be the most effective.
Okay. So now you've talked about point of care. So we're talking about health facilities, health clinics, hospitals, doctors' offices, those kinds of things when we talk about facilities, right? So as a health worker or a caregiver, perhaps I'm taking care of someone at home who's ill, or as a facilities manager, what should I expect to see in a health setting, or what should be provided in a health setting to ensure proper hand hygiene?
So as we said before, as a healthcare worker, I should be able to access hand hygiene facilities at any point of care. So if we look at this poster, this is a poster about a call to action for facility managers. Here there is a patient room where the patient is in the bed and the health worker is performing hand washing. So this is an ideal setting where hand hygiene facilities are there at the right place. It means that you have a sink, you have soap, you have hand towels, you have alcohol-based hand rub very close to the bedside. And this means that these health workers, having all these supplies and infrastructure, can perform hand hygiene when it's needed, according to specific indications that WHO has, and with the right products. So this person will be facilitated in performing hand hygiene action every time is needed. So this is what we ask facility managers to ensure that this infrastructure is there every time for healthcare workers to comply with this recommendation of performing hand hygiene, which saves lives.
Excellent. So we're starting to receive some questions here from our audience. And again, if you're just joining us, we're talking today about hand hygiene in celebration of Hand Hygiene Day, World Hand Hygiene Day tomorrow. If you have any questions, please go to our Twitter account and send your questions to #AskWHO, or you can go to our Facebook feed and leave a comment there, or in our LinkedIn feeds as well. Benedetta, one of the questions that we've just received is, what kind of products should we be using to wash our hands? You know, we often have this idea that you must have hot water, you must have soap, or you must have chlorinated water, these kinds of things. So are there specific products that should be used?
So ideally, simply, you can use either soap and water. Even normal plain soap is effective in most cases, or alcohol-based hand rubs. Alcohol-based hand rubs, which are normally called hand sanitizers, and the best ones should comply with some quality requirements that exist, and should contain from 60 to 70% of alcohol. So these are the best ways to perform hand hygiene. In healthcare, usually the preferred method should be through alcohol-based hand rubbing. This is because these sanitizers can be found anywhere, like even in pockets, you can carry it. So it can be really available when you need it, at the bedside, as I said, or at the point of care. They act faster, as I said earlier. They take less time to achieve efficacy on your hands, and also they are better tolerated. But hand washing with soap and water when alcohol-based hand rubs are not available is also fine in most cases.
Excellent. So this year, WHO is celebrating as well a year-long campaign of the health and care worker. And we're tying hand hygiene into that particular campaign. Why is that? Why is this important?
So, first of all, as you know, the year of health and care worker is celebrated to really express gratitude and recognition to the health workforce, in particular during this pandemic. We also know that unfortunately many health workers lost their lives while providing care due to COVID and also to other reasons. And the connection with our hand hygiene campaign is really that hand hygiene is a measure which has been demonstrated in particular in this campaign, in this pandemic, to be effective in protecting health workers, obviously together with other protections such as personal protective equipment. But it's one of the protective factors that has emerged from recent evidence for health workers. So this is the very important connection. And also to remind them that we are here to support them to perform hand hygiene at the right time and in the right way.
So this focus on point of care and on health workers in particular, are we focusing on this because there's a problem or because we just simply want to continue encouraging good behavior? What do we see in healthcare settings?
Well, we see that we still have defective infrastructure, as I mentioned before, especially low middle income countries. In fact, 3 in 4 healthcare facilities worldwide lack clean water. And regarding hand hygiene at the point of care, 1 in 3 lack these facilities. And also, we saw that according to a survey that we recently performed, in low-income countries, only 17% of facilities have continuous provision of alcohol-based hand drops, compared to 75% in high-income countries.
So that's 17.
Yeah, 17.
Wow.
Yes.
So it's really serious.
So it's a problem of infrastructure which enables the right behavior normally. So this is why in our campaign we actually call to policymakers to invest and dedicate finances and also policies in order to provide the right infrastructure for hand hygiene, both in healthcare facilities but also in the public, like schools.
Okay. Yeah, and I've noticed in the campaign this year, many of the materials that are available on our website, you have messages or messaging for a vast number of audiences. So it's not just health workers, but also patients, caregivers, policymakers, vaccinators, as you mentioned in your opening comments. So it's everyone really who can contribute to this.
Of course. So the peculiarity of this campaign is to focus on the healthcare sector, but the pandemic has been an invaluable opportunity also to promote hygiene and hand hygiene more broadly throughout the society. And in fact, it's important to mention now that UNICEF and WHO have launched a new initiative which is called Hand Hygiene for All, actually to respond to the DG's recommendations, WHO Director General recommendation last year for achieving universal hand hygiene, which means really having hand hygiene stations in all public places, in all healthcare facilities and beyond. So, as you said, our campaign really targets different audiences who are key players in the healthcare sectors, including patients and families, but also this year really calls upon everyone to engage and to make hand hygiene a continuous habit in their daily life.
Excellent. Well, and you mentioned COVID-19 and the current situation that we're in, and I certainly know I found myself in the last year washing my hands and using alcohol-based hand rubs far more than I did prior to that. What, people are kind of scared right now, and there's a lot going on in the world at the moment. We're seeing alarming increases in the number of cases and deaths around the world, and in some countries in particular. And people are trying to find ways that they can protect themselves from this disease. So what else, are there other recommendations in addition to hand hygiene that we have for people in this case?
Of course. So as I said at the beginning, hand hygiene is one measure which needs to be part of a comprehensive package of measures that WHO has continued to recommend since the very beginning of the pandemic. So these measures include certainly the use of masks, of course, in the community and in healthcare, hand hygiene, distancing, avoiding overcrowding, having good ventilation and airflow in all settings. And then, of course, respiratory hygiene. If you have symptoms, high respiratory tract infection symptoms, and if you are sick, the ask is really stay home until you are better. And then other measures such as limitation of movements when it's really needed. And isolation of cases, tracing of contacts, and quarantining contacts. There are more measures than this, but these are really the key measures.
Yeah, I think in WHO we're communicating this as do it all.
Do it all,
yeah.
Exactly. Do it all at once. And I have to say that even recently, in the new waves that have come up over the last 4 or 5 months, countries, and also with the new variants circulating, countries that have really very tightly applied these measures have continued to succeed, including, for instance, United Kingdom, where, as you know, there was one of the most remarkable variants of concerns, managed to really bring the cases down, thanks to continuing to apply these measures, and of course, thanks to this invaluable new tool, which is the vaccination. And this country, like Israel or like UK or others, have now reached really almost 60% of vaccination coverage, and obviously they are doing better than others where the restrictions and the measures I mentioned are less widespread or tightly used, and the vaccination is still moving forward and progressing, but not at sufficient coverage.
Yeah. Well, so we're receiving some questions from our audience here, and I'd like to just go through a few of those, if that's okay. So we're being asked by Joan, excuse me, she wants to know, the whole ward, when you're in a facility, in a health facility, the impression she has is that it needs to be cleaned and all personal hygiene equipment should be in an appropriate place or in places where this can be reached, in cupboards and drawers near the bed, and should always be replenished. So the illustration that you showed us, this is what we're looking for when we look for this kind of thing in facilities, correct?
Yes, of course.
Proximity.
So to have the supplies in place, to have a clean environment, to have good waste management, in particular for sharps, for instance, at this point, given that we were talking about vaccination. So this should be the norm. And of course, you can have, in high-income countries, you can have shining, very advanced, innovative technology or ergonomic solutions. But this can be also very simply achieved in low-income countries and low-resource settings with really the basics in place. So it's possible in any country.
So is hand washing better than using hand sanitizer? You touched on this a few minutes ago, and you said that actually hand sanitizer is more effective.
Yeah.
Why is that?
Well, because alcohol has a high level of efficacy against a very broad range of pathogens, from viruses to bacteria in particular and fungi. And so it allows basically a faster killing of this range of pathogens. This is why it is considered more efficacious. It's not only faster, but also it achieves a higher reduction of the burden of these germs on our hands. So this is why, in general, it is preferred, especially for healthcare, apart from obviously when hands are visibly soiled, where you obviously have to use hand washing. But so, as I said, for COVID, hand washing with soap and water is okay, is good, provided that it's performed in the right way.
So David Brigine is asking us, if I've washed my hands, can I then shake hands with people? Is that appropriate?
Well, nowadays, while COVID is still widespread, in countries where it is widespread, we still really recommend to avoid contacts between people and shaking hands. Mm-hmm. So I think for the moment, this kind of proximity, unfortunately, needs to be avoided. And we all know how difficult it is for everyone. But especially where the outbreak is still widespread, we need to avoid contact.
Yeah, I think that's been, it was a challenge for all of us. I know here in Geneva, the habit is to greet each other with a kiss on the cheek, and we've all had to learn to not do that. So I guess if we can't do that, we shouldn't be shaking hands either. We also have a question from someone asking, does salt water clean hands? Is that a good formula to use for cleaning hands?
I would say no. There is no evidence, and also it can do harm probably, because certainly it's not good for your skin. So yeah, I wouldn't say that that's useful.
Okay. Well, let's so we've talked about hand rub, we've talked about soap and water. Clearly things like salt water, we know, not something to clean with. I've also heard anecdotes of people sometimes cleaning with sand. I guess we would say that's not a good method for cleaning hands either.
Well, there is some evidence from years ago that using ash can be effective to prevent some bacterial infections. We recently performed a review of the evidence for respiratory viruses and COVID, and at the moment there is no good evidence to show that this is effective. But of course, if you don't have anything else, the mechanic movement and friction with ash or sand can still help to mechanically eliminate pathogens from your hands.
But where possible, of course, always soap and water or an alcohol-based hand
better.
rub. Yeah.
Yes.
All right. So in terms of tomorrow's activities, what are we doing to mark this day tomorrow?
Okay, so, well, first of all, there is a campaign. So there is a web page that people can find by digiting World Hand Hygiene Day, WHO, where there are many activities that are suggested. There are some prominent activities these days, obviously, through social media. We ask people to speak up through social media, Twitter, TikTok, Facebook, and anything else using specific keywords and hashtags, which can be found in the screen behind me. We have a special initiative for showing commitment by anyone, in particular health workers, which is called Faces of the Campaign. So we invite anyone to send their video performing hand hygiene, or to take a picture of themselves using a frame that it's available on our website, and also using these posters where they can replace their picture instead of the scenario that is on the poster. and send these images to a website which is available on our campaign page, where we build a wall of faces, the faces of the campaign. So tomorrow then we will take shots of this wall, and we will promote them through social media. Tomorrow we will also have a couple of webinars or events. There is a high-level meeting with leads and policymakers from countries and some partner organizations that it's convened by our Deputy Director General, and also we will have a technical webinar which is held by myself and Professor Didier Pittet, who is our special advisor for hand hygiene and infection prevention and control on Weber training. So these are the major initiatives, but there are also regional initiatives. There is another webinar tomorrow morning in the African region, which is featured by our regional office, and also a lot of promotional activities from the other regions. For instance, the Eastern Mediterranean region will do press releases and also a country story. We will also have a press release tomorrow, so we'll have many things to celebrate and to also spread the word about this campaign and the importance of hand hygiene.
Excellent. So just one other question. We've had a couple more questions come in, but is it necessary, and again this kind of goes back to the hand sanitizers, after I've used a hand sanitizer, do I need to wash my hands with soap and water, or am I fine?
No, actually it is even contraindicated, because especially in healthcare where you have to do it very frequently, doing this double technique, it really harms your skin. So it is useless, because either technique, either type of product, if properly used, leads to the decontamination of your hands. So you don't need to use them both, basically, and it can really increase the damage to your skin.
Okay, so just to review again then very quickly, if I'm washing with alcohol-based hand rub, how many seconds? And if I'm washing with soap and water, how many seconds?
Okay, so if you are rubbing your hands with a hand sanitizer or alcohol-based hand rub, you have to take about 20 to 30 seconds for the whole procedure to cover all your hands surface, possibly by following some steps that WHO recommends, including the drying. And if you hand wash with soap and water and dry with towels, it takes about 40 to 60 seconds to be effective.
All right, and as we know, cleaning hands saves lives, so seconds save lives. All right, excellent. Thank you for joining us today, and thank you, Benedetta, for being with us today to talk about this. We've been joined today by viewers in Ecuador, Togo, Pakistan, Qatar, Turkey, Cameroon, India, Chad, Italy. We've had people from Senegal, Malaysia, Colombia, Zambia, Zimbabwe, Iran, Cambodia, Ethiopia, the United States, Jordan, Canada, Kenya, Bulgaria, Austria, and Australia, the Sudan, Nigeria, Portugal, Tanzania, and Barbados. To all of you who have joined us today, thank you for being with us. Please do wash your hands. Please do follow all of the health measures that we've asked. Wear your masks. Wash your hands. When you can be vaccinated, please be vaccinated. Do it all. We wish you the very best. Stay healthy, stay happy, and we'll see you again soon. Thank you.